Hello there. Welcome to my show, COVID-19 update by Heerak. It's December 13, 2020, 12 days before Christmas. Can you believe it? Time flies, right? Today is candle lighting day. So if you have someone who died from COVID-19 during year 2020, 2020, today is the day to light a candle. Obviously, many people are going to have many people die from now until June 2021. Most scientists are saying COVID-19 condition is until 2022 at least. I'm predicting it's going to be at least 10 years. Um, there's this presumption or prejudice that COVID-19 vaccines will work. And it's a blind superstition, I would say, because there isn't really scientific data to support that COVID-19 vaccines will work in every segment of the population, people who have cancer, people who have diabetes, people who have heart conditions. Um, there isn't real life scenario data right now, I would say. Um, so I guess basically the data will be collected once people are vaccinated. Data will be collected as to what happens to them. Um, as you know, my prediction is that the vaccine, because it's rushed, it wasn't vetted over a long period of time. You need time to see long-term and short-term side effects and adverse effects of anything. I'm predicting that the vaccine will probably harm some people. Um, that it may compromise their immune system. And so let's see I'm right or wrong. People are going to be vaccinated. Um, and there may be a big spike in COVID-19 cases and death. That means I'm right, more so than the projection. Um, so, whereas 100,000 people might have died in a state, at the vaccination, 400,000 people died. And let's say over 50% of the people who are vaccinated get COVID and die. Then I was right, right? Their immune system was compromised. So let's see, in many hospitals, nurses are going to get vaccinated. Doctors are going to be vaccinated so we can study the nurses who got vaccinated and see if they get COVID or not. And if there's a high number of vaccinated nurses getting COVID and dying from it, then you know that it's probably compromised their immune system. I'm not I'm not going to get COVID vaccine. I already told Virginia Hospital Center I'm not going to get COVID vaccine. They offered it to me. Obviously, I'm a nurse, registered nurse in Virginia. So I was one of the first person in Virginia to be offered the vaccine. Um, but I told them no. And, I said, I'm not taking the vaccine. Thankfully, they made it optional, so I don't have to take the vaccine um, because it's not tested enough. It hasn't been around long enough to be trustworthy. It's like anything, you build something really quickly, there are going to be problems, you have to fix it to kind of work out the nooks and crannies. So, the first batch of vaccines, they're going to have a lot of problems, just logically, and just in terms of how things are developed. Right? Anybody who's developed anything knows it takes time to like perfect it and work out all the problems. So, I don't want to be kind of a lab rat test case. And so I told Virginia Hospital Center I'm not going to get the vaccine. Thankfully, Virginia Hospital Center was smart enough to give us the choice to take the vaccine or not take the vaccine. So I said I'm not going to take it. Because I don't want a situation where I get the vaccine and that compromises my immune system, so my natural body cannot fight off the, exposure to COVID. Because you could be exposed to COVID, but your natural immune system can fight it off, so you don't get infected. It's like any kind of infection. Um, when you're exposed to something, bacteria or virus, if your immune system is strong enough, then you'll fight it off and win. Um, but if your immune system isn't strong enough, then you get infected. So we're talking about like initial stages, right? Obviously, once you are infected, your body system has to fight it off as well. But as you know, like there's bacteria all over your hand right now. And because your immune system is strong, you're not getting sick. But if your immune system goes down, the same bacteria that's not making you sick now can make you sick. That's why being immunocompromised is a horrible thing. Um, they said even immune compromised patients should not eat fresh fruit or fresh vegetables. Because just eating fresh fruit or fresh vegetables can cause infection for people who are immunocompromised. So like there are cancer patients, some of them who are going through chemotherapy who can't eat fresh fruit or vegetables. So yeah, so it's just it's a bad situation for our country to be in. I mean, I understand that. Obviously, every one of you have to make the decision yourself. Um, I mean, there are a lot of nurses who worked through the first wave who didn't have a vaccine and who survived without any problem. Many of them did not get infected. Some of them got infected. So let's say these nurses who are immunocompetent get vaccine, and then in the second wave, because they got vaccine, they become immuno incompetent. I mean, it's possible. I'm not saying it will definitely happen, but it could happen. And so that's the problem. We don't know what will happen. And that's why I want to wait at least a year from getting the vaccine, because I don't want to be the test model, you know, because let's say you get the vaccine and it happens to be that your body immune system becomes compromised, that the vaccine developers maybe knew about but hid or did not know about. Um, Whatever the reason, at the end of the day, you're the one who gets infected and you're the one who dies, right? So, uh, everybody has to make their decision. I'm not saying that it will definitely happen, but there is a possibility. And the saying, if it works, why fix it? So if your body immune system has worked in the first wave of COVID, taking care of COVID patients, you survived. I mean, there's a chance you'll survive the second time around as well. But if you change the dynamic, like you inject yourself with an experimental vaccine, then that may compromise your immune system so that you get COVID and die. You see what I'm saying? It's like the principle of if it ain't broke, why fix it? You know what I'm saying? Um, Especially if the cure can be worse than the disease. And the vaccine. I know like several Republican senators like to tweet that the cure can be worse than the disease. And I think several senators I've seen it tweeted, and I think it applies to the vaccine because it's too experimental. I know, like, when people are desperate, they just want to jump at anything and believe anything they see and what people tell them. But it's not really that trustworthy right now because it's at experimental stage. So when they like push the vaccine on you and make it seem like it's going to work, I think it's natural for people to get suspicious. Why are they pushing it so much, making it sound like there's no problem? I mean, it's kind of like a used car salesman. You know, when they say there's no problem, it's it's hard to believe. It's a used car. Like vaccines experimental. Obviously, there's going to be some problem. How come they're not able to tell us what the potential problems are? So that makes it more suspicious too. Um, yeah, so it's just, like, whenever we give medication, we tell them what the side effects will be. Like, we give you this painkiller, you may have constipation, you may have nausea, you may have dizziness. We tell people what the side effects could be. I mean, they won't definitely get it, but they could get it if they get a medication, because every medication has side effects, right? Potential side effects. So my question is, what are the potential side effects of this vaccine? Um, we haven't really received any kind of data about that. So are we supposed to think that, like, there are no side effects? I mean, we're not. They're not going to tell us what the two side effects are. Um, you see what I'm saying? It seems um, it seems kind of specious. It seems like they're trying to hide something, and that's the problem, because you've seen a lot of movies where government experiments with things and they hide things from the citizens. And you probably saw the movie Brockovich. Companies hide things from people all the time. Like, sometimes company scientists know that there's a problem, but they hide it because they want to make a profit. Because they think they can get away with it. And that was like with Aaron Brockovich kind of thing. And there are a lot of movies that kind of highlight that. So, I mean, I'm not saying movies always accurate, but movies often portray a possibility. And it's possible that this kind of government scientific experiment has a lot of problems that may be highly classified, um, but which exists. You know what I mean? So yeah, I mean, you do what you want, but for me, I've decided not to take the vaccine, just because it's too experimental, it's too soon, and there isn't enough research, about the side effects, adverse effects on different types of populations. So yeah, I'm not taking the vaccine. I already told Virginia Hospital Center. I mean, I'm thankful that Virginia Hospital Center is not going to require you to take the vaccine, because I think that would be unethical to do when the vaccine has not been vetted yet. It's not like vaccines which have been vetted for many many years that are proven with millions of data to be completely safe. This is not one of those things. So I'm going to wait one more year, and if we have enough data that shows it's safe, uh, and if that it works, maybe I'll take it next year. But I'm doubting that it will work, and I'm doubting that it's safe. That's the problem right now. Um, yeah, when we talk about lighting a candle lighting day, we think about death, right? Because you light a candle for somebody who dies, and I feel like there should not be an unnecessary death. You know, uh, there are ways to survive this COVID-19. You social distance, um, isolate yourself, uh, work from home, study from home. These are all possible things to do. There's no reason to rush the vaccine, warp speed, and try it out on population who are rushed to take this vaccine. I just don't feel that that is a good public policy to go. Um, I feel like we need to put safety first. How can we make it so that the citizens are safe? If we can have the school at home, let's have it at home. If we can have work at home, let's have it at home. And let's take our time with the vaccine so we can perfect it, test it out, and then let's roll it out. But it's like everything is too rushed, and that's a problem. Whenever you're rushing, there can be so many problems. You know what I'm saying? And anybody who's worked on a project know, like, rushing can be a serious problem. And so that's why I'm not taking the vaccine. But obviously, you take the vaccine if you want. Um, I'm glad they gave us choice, because if there's someone who want to take the vaccine, take my vaccine. I don't want to take it because I think it's unsafe. That's just my opinion. But based on my scientific perspective and my need for data, I don't have data that this is safe. So for me, I need the data, and they don't have the data. And so for me, so that's a problem for me. Um, yeah, it's Christmas time, and I remember like 1 year ago, I went to a homecoming basketball game at Philmont Christian Academy in December, and I met up with like my high school teachers at Philmont Christian Academy in Erdenheim, Pennsylvania, which is in Montgomery County, Pennsylvania. And so let me see. The guy right below this video, that's Mr. Struck. And below that, there's his fellow alumni. And then I have a photograph next to our Philmont insignia in front of the building there. I went to Philmont from seventh grade to Hillcrest campus in Earthland, Pennsylvania, in Montgomery County in Pennsylvania. From seventh grade to 12th grade, like all 6 years of middle school and high school. So it brings back a lot of good memories. Um, so the gentleman in the red jacket in the center is Mr. Biersma. He's my math teacher. I really like him. He's a nice guy. He was a single guy, and then he met this wonderful woman. They got married. That happened during when I was his student. So I was really happy for him. Above that photo, you see Jochi. Jochi is the brother of Janchi. Janchi and I were close friends when we first arrived in the United States of America. Jochi's father, Elder Chi, picked us up from the airport, Philadelphia International Airport, or was it John F. Kennedy Airport? I mean, Jochi's father, John Chi's father, picked us up from the airport. And John Chi's father was, one of the ruling elders at First Korean Presbyterian Church. So he's one of the ruling elders who extended the call to my father to become a senior pastor at First Korean Presbyterian Church. So I grew up with John Chi, who's the older, we're friends. Jochi is his little brother. Both John Chi and Jochi ended up becoming Christian pastors. And so Jochi is a Christian pastor and a Bible study teacher at Philmont Christian Academy, and his children go to Philmont Christian Academy. And so, so he also is a girls basketball coach. Like we had the homecoming, and he was there. And then next to that is younger brother, interestingly enough, of Kevin Dalton, who was in my class. So Kevin Dalton couldn't make it, but his little brother was there. And next to that, you see Mr. Sortness. He was my history teacher. He was a headmaster of Philmont Christian Academy for a while. We're sitting in the bleachers. And Mr. Sortness told me that he one of his daughters is studying nursing. So I wanna meet her. She and Mr. Sortness and used to invite us over to his home for like a pizza that was homemade by his wife. His wife is great. Uh, and um, and Mr. Sortness said two of his children live here in this area. I think his son may even live in Virginia's 8th district. So if you are, email me. Yeah. So and then it's a small world. Life is kind of like that. Everybody connects. Life is very small. And also like these my teachers are mostly Christian Reformed Church or Presbyterian Church in America or Orthodox Presbyterian Church. Um, and so they tend to be kind of they know people. you know. So if they're a Presbyterian Church in America in Virginia's 8th district, or Christian Reformed Church in Virginia's 8th district, or Orthodox Presbyterian Church in Virginia's 8th district, they all connect. So there's a high possibility they know each other, especially like among Christian schools. But American society is highly mobile. So next to that is Mrs. Rocky. She went to Calvin College, met her uh, husband at Calvin College, and Mr. Rocky was my middle school English teacher, a Bible study teacher, and Mrs. Rocky was my English teacher in middle school. She's really nice. So it was nice to see her, and so we did a little selfie there. And I remember like Abigail, Elizabeth Rocky's daughter, Abigail, being born. And, like she's like now, like college student or whatever, or she may even be a teacher. I think Mrs. Rocky said she was a teacher. So it's like, whoa, time flies by, you know? Yeah, I love to see Abigail now. You know, I saw her when she was little, held her, there, you know, like a little baby in my arm, kind of, you know, when we went over to Mr. Rocky and Mrs. Rocky's home. But she's like a grown woman now. You know, life is like this, kind of funny, right? Little baby becomes a, you know, a woman. You know, it's like, yeah, it's always kind of fascinating when you see that. Um, yeah, so yeah, so you know, today's Sunday, as you know. So we have 1,374 people who are reported dead so far by Sunday. You know, people like put off like reporting, so it's probably far higher than that. It's probably more like 3,000, close around 3,000. So Sunday, you know, people are not reporting everything. They're going to church, spending time with church friends, you know, spending time with family. So, you know, we'll get like the data a little bit later, probably. But so at current rate, we have 16,246,771 cases, and death rate is 2%, and we have 299,163 people who are dead now from COVID. I'm predicting that we're going to have about 30 million Americans dead by COVID from now until June 2021. So in about 6 months. And my prediction is based on several factors. Once ICU and hospital beds run out, up to 100% of the population can die. So if you have, you know, you see you have like what almost 200,000 cases in 24 hours. All of them can die if they need hospital. 200,000 in one day. You know, if they need hospital and they can't get to it, all of them can die. So count the scenario where every day 200,000 people can die just because they don't have any hospital beds left. So that's coming, you know, in the future, but definitely before June 2021. It may be coming in January. So, you know, I don't think you should be surprised if we have 200,000 people die, like in, you know, January or February, because, you know, eventually people are going to get sick, more people are going to get it, and they need hospitals, they can get to it, so they're going to die. So I'm counting, you know, possibility that we could have over 100,000 people die in one day because hospital ran out of ICU beds, and hospitals are full, not just ICUs, but regular hospital beds are all full. And you have 200,000 cases per day. In 1 week, you have 1 million cases. And if 200,000 of them need hospital, they could all die. So yeah, I don't think you should be surprised if you turn on TV in January or February and they say 200,000 people died yesterday. I don't think you should be surprised. And, you know, especially because I told you that that could happen. So you know, I'm preparing you for what could happen. So that's one reason hospital beds and ICU beds run out. Second reason, as I've kind of explained before, if this vaccine has problems that the scientists, you know, they kind of concealed from us, you know, or the government concealed from us, and those problems are actually bigger than they anticipated or thought, then because of those problems, people can die. So, or, you know, maybe they didn't know that there was a problem, but there actually is a problem and it gets discovered weeks after vaccination. So I'm predicting that we're going to have millions of people die who are vaccinated throughout America. Uh, Not necessarily directly from the vaccine, like vaccine is not the poison, although that could happen with some people. But because vaccine compromises your immune system or your bodily functions in some way, allowing for, let's say, the flu to infect you or COVID-19 to infect you, you know, something to infect you that you would not have been infected with had you not taken the vaccine. So my estimate is we're going to have millions of people die as a secondary causation from taking the vaccine. So that's my prediction. That's why I'm predicting that 30 million Americans can die. And third reason is you're going to have a lot of nurses die from COVID-19. And so, you know, a lot of nurses died in the first wave too, or first peak. We're in the third peak. Um, so we're going to have a lot of nurses die. And once the nurses die, obviously more patients will die. So when the nurses are not dead and fully functional, you may have 100 patients and you may have 10 die. But once nurses start dying off, you may have like out of 100, 30 patients die. You see some more can die just because nurses died off and there's like shortage of nurses. Um, and there's also nurse fatigue that you might have seen on TV discussed. So there are a lot of nurses who are kind of fatigued because of the emotional toll that COVID-19 takes on them. They've seen a lot of people die of COVID, and that impacts their care. These are human beings, they're not robots. So that could cause death as well. So the third element is like healthcare workers, nurses, either dying or getting sick or having fatigue that impacts higher death rate. So these are three major things that will cause death. And the fourth thing is PPEs running out or lack of equipment. So there are patients who could live, nurses who would not be infected, but because personal protection equipment ran out or there are not the equipments that you need, people die or nurses get infected and die. So that's the fourth element, equipment failure or lack of equipment. So these are things that I think we're going to face because we have this is only December, so we have December, January, February, March, April, May, and June. So we have like 7 months to go. And COVID-19 is going to grow exponentially. We're not in winter yet. We're in the fall. So once we enter winter, there's going to be a big jump in not just COVID, but in flu and other kinds of winter ailments, which can be in the millions. And so we may have millions die from those. So, like we don't know what's coming, but we know it's going to be hell on earth, COVID-19 hell on earth next several months. That's like something that all the scientists agree will happen. And I'm predicting we're going to have 30 million Americans dead by June 2021. I hope I'm wrong, but I may be right. Right now, look at Asia. Asia is not suffering as much as we are. Um, India has 9,857,000, 29 cases. At 1% death rate, their death rate is low. 143,019 have died. But they're number one. But look at number two. They haven't even hit 1 million cases. Indonesia is number two, 617,820, 3% death rate. Only 18,819 have died. Bangladesh, look at number three, 490,533 cases. Only 7,052 have died, 1% death rate. Philippines, 449,400 are infected, 2% death rate. Only 8,733 people have died so far. We're talking about from the beginning until now. And Pakistan, 438,425, a 2% death rate. Only 8,796 people have died so far. So Asia is doing really, really well compared to America. But America is doing really badly. And that's a serious problem. Yeah, so today we're going to look at the country that's having the biggest problem right now, which is Italy, according to some estimates. So the title is COVID-19 World. Italy has most Europe COVID deaths. So Italy surpasses UK for worst COVID-19 death toll in Europe. That's the first article by Francis De Melio in Associated Press. And the significant quote from that is, Italy on Sunday eclipsed Britain to become the nation with the most official coronavirus death toll in Europe. Italy, where the continent's pandemic began, registered 484 COVID-19 deaths in one day. But that sounds like peanuts to us, right? But we're number one in the world for COVID-19 death, right? It's, we're significantly higher in death rate than other countries. Um, so registered 484 COVID-19 death in one day, one of its lowest one day counts in about a month. Still, those latest death pushed Italy's official toll up to 64,520, while Britain stood at 64,267. So they're kind of going up similarly, right? At the same similar rates. According to a tally by Johns Hopkins University, a little more than half of Italy's known COVID-19 deaths were registered on the first surge. So that was like in April, March or April. Um, on Sunday, Italy reported another 17,938 coronavirus infections to raise its official tally to 1.84 million. By far, the highest number of new infections was the northern region of Veneto. Italy's Lombardy region has the highest number of cases and death overall. But remember, this is only December. We have December to go, January to go, February to go, March to go, April to go, May and June. So I'm predicting at least 1 million people will die in Italy by May or June 2021. At least 1 million, probably more. Um, Second article, World Health Organization, WHO, accused of conspiring with Italy to remove damning COVID report by Angela Giuffrida in The Guardian. And the significant quote is that the World Health Organization has been accused of conspiring with Italian health ministry to remove a report revealing the country's mismanagement at the beginning of the coronavirus pandemic, the publication of which was intended to prevent future deaths. Italy was the first European country to become engulfed by the pandemic. The report produced by the World Health Organization scientists Francesco Gambon and 10 colleagues across Europe was funded by Kuwait's government. So you see that official organizations like World Health Organization, which is the global health organization, right? And Italian Ministry, which is official government agency dealing with healthcare in Italy, they're conspiring. The accusation is that they're conspiring to hide reports that give damning report. So what I'm saying is this: same thing is happening with vaccine. You can be sure. If there are problems with vaccine, those reports are being um, removed, so you don't hear about them, right? Either they become classified. So if there is problem, and I'm thinking there are problems, they can be classified so they're not revealed to you. And their rationale will be, well, we're in a state of national emergency, and that's why we're going to emergency authorize it, knowing that there are known problems. But we're going to classify them because we don't want our citizens to panic. So we're going to classify it. So we're not going to tell anybody what the problems are, but we know it. You see what I'm saying? So that's what I'm thinking is happening behind the scenes, because the whole concept of emergency authorization, whenever people say emergency authorization, it should signal like alert, alert, alert. Do you know why? Whenever you have an emergency measure, a lot of things are going to get classified. They're going to say it's an emergency authorization. We're going to hide all the problems. You see, it allows them to do that because it's an emergency authorization. So they said, because it's an emergency, um, we're going to hide these facts. So my guess is that that's happening behind the scene because they didn't have to do emergency authorization. So they could just authorize it. But the terms that are being used kind of reveal what's going on in the background. Do you see what I'm saying? And this is what we historians do when we study history and we study governments and what kind of decisions were made by governments. Um, we use like key phrases that alert us to something behind the scenes. What Plato says is, what you see is not the reality. Reality is the shadow. Or what you see is the shadow. The reality is behind what you actually see. So that's my suspicion as a critical thinking historian trained at UCLA. Uh, because I've been doing history for decades as a professional historian. I'm a certified expert of history, Jewish studies. And so I'm professionally trained with keen eye to search for these irregularities, catchphrases that alert us to government actions that are behind the scenes. So I'm an expert who's trained to just catch things like that. One catchphrase will reveal a whole potential issues. And when you dig it up, there always is a problem. That's what makes me an expert historian. One catchphrase reveals a whole semantic world that actually is tied to reality, right? That is associated with the semantic field. And so that's why I'm not taking this vaccine. There are several reasons, right? Governments always do cover up for all kinds of reasons, right? In the name of national security, they do cover up. When the government created an error and it doesn't want to protect politicians or important people, quote important people, they cover up. Remember Benghazi? No one, like Hillary did not go to jail for that. Uh, you know, all kinds of government errors happen, and they get smoothed over, right? They get classified, smoothed over. When Benghazi happened, we found out later how Hillary Clinton was involved, right? You see, like Joe Biden and Hunter Biden doing some shady stuff in China, right? But obviously, Joe Biden wants to put a quash on it, make it classified, and doesn't want you to ask questions about it. Because he wants to protect the son, no matter how corrupt he is. You see what I'm saying? Um, so you're going to have cover-ups in governments. I mean, that's just something, unfortunately, exists in every government. And generally, if the government is operating in a healthy way, the cover-ups are kind of checked or revealed, right? There's a scrutiny, and then to a certain extent, we saw that with Benghazi, right? That was scrutinized. We saw the problems that Hillary Clinton made. So it kind of showed Americans that government watchdog system is working, right? And when Hunter Biden is discovered to be doing some shady stuff in China, most Americans realize that some of our system is working well. Like corruption alert systems. But the problem is there are things that are kind of classified and hidden. And the problem is what is being hidden about this vaccine. You know, um, that's a problem because we don't know what the side effects are, right? I mean, they must know what kind of side effects are there for what kind of population, but they haven't given us any information. So they're covering up something. And that makes them more suspicious because side effects must be severe. That's what I'm thinking. You know, um, Maybe not severe in everybody, but it must be severe in some people, severe enough that they have to cover up the data. And that's why they're calling it emergency authorization. And FDA hesitated, for a while to authorize it. That also raises some questions too. What were the factors that caused hesitation? We need to know all the data, and we don't know the data. FDA has not revealed it to us, maybe because it was protected under the National Secrecy Act, or National Emergency Act, one of these things, So this is why I'm not taking the vaccine because I think there's a problem there. Um, yeah, I mean, I like to see every single senator and every single House of Representative who are in the intern intelligence committee get the vaccine, like on TV. I like to see that. You see what I'm saying? I love to see like President Trump get the vaccine on TV. President, Vice President Pence get vaccine on TV. I want to see that. You know, and vaccine delivered like, I love to see that because they're telling us to take the vaccine. They're telling us it's safe. I need to see them take it. I need to see Joe Biden take the vaccine like on TV. I need to see like Kamala Harris take the vaccine on TV. I want to see that. Like, they're telling us to take the vaccine. How do you know they're taking the vaccine? Right? You don't know. So, you see what I'm saying? I think US citizens need to see Joe Biden taking the vaccine on TV. US citizens need to see Kamala Harris taking the vaccine on TV if they're telling us to take the vaccine. Would you agree? Right? Because if they're not taking the vaccine because they have intelligence regarding side effects, right? I mean, so don't you want to see Joe Biden take the vaccine on TV? Yeah, you should call your local TV channels, contact CNN, Fox News, and say we want to see Joe Biden and President Trump take vaccine on TV. Yeah, you should do that right now. Go and email them or call them. You can message them. And let them know that's what you want. You want to see Joe Biden take the vaccine tomorrow in person. You want to see President Trump take the vaccine in person. Yeah, right. They're telling us to take it, so they should take it, and we need to see them on TV taking it. Right? Would you agree? Um, yeah. So I'm not taking it, but I'm not telling you to take it either. Right? People are telling you to take the vaccine. Should take the vaccine on TV. Yeah, all the governors should take the vaccine on TV. All the mayors were telling you to take the vaccine. They should take the vaccine on TV. We need to see it. Um, so, third article, Italy's staggering virus toll poses uncomfortable questions. Just like America's staggering virus toll, you know, uh, poses uncomfortable questions for us too, right? This is by Nicole Winfield, Associated Press. Italy then had the benefit of time and experience heading into the fall resurgence because it trailed Spain, France, and Germany in recording big new clusters of infections. Yet, the virus spread fast and wide, and Italy has added nearly 29,000 dead since September 1st. So in the second wave, well, in Europe it's more like second wave. In America it's like third peak because we we well in Europe it's more like second peak because it never went away. So in America it's more like third peak because the summer was a really bad time in America. Um, so Guido Rossi toured state TV after Italy reported a pandemic high record of 993 deaths in one day. This is much higher than the European average. So Italy is suffering. They have like 1,000 deaths. So think of Italy as one of the states in America, right? Because I mean, obviously, it has far more people than a typical state. Um, but 1,000 deaths is a lot. So there's a problem in Italy right now, and it's not even winter yet. That's the problem. So you can imagine, like during winter, they could have easily have 3,000 deaths per day, Italy, or more. So that's coming to Italy, unfortunately. So yeah, I mean, Italy may see Santa Claus saying hello and then goodbye, hello, goodbye. Because Santa Claus doesn't want to get COVID. So he's saying goodbye. I'll drop the gifts off on the chimney, but I'm not coming in there. you know. So make sure you keep the chimney open. Um, I'm hoping for like you know, a white Christmas, you know, I don't know if we're gonna have White Christmas. I'm hoping, so I'm just kind of keeping that open. But the biggest problem right now for all of us in America is the red reindeer. It's completely red, not just the nose. We're talking about COVID-19. You know, I mean, it's like red reindeer is a symbol for COVID-19 death. Like wherever the reindeer trail goes, and there's death. You know what I'm saying? I mean, geez, I think that's the biggest fear that we have right now in America is proliferating COVID-19 death and us not being able to survive it. Um, as I said, I'm predicting at least 10,000 COVID-19 deaths before Christmas. I know we have 12 days to go, but I think we'll make it. Because, we had like 33,000 deaths. We could get to 10,000, I think, by Christmas. I mean, we may miss it. We may get 10,000 in January, but I think we will get it before Christmas. So, let's see. Um, and then, I'm thinking, maybe we could even hit like 30,000. So they're saying that some people are going to be vaccinated tomorrow. So that throws a wrench into the system. If I'm correct, I'm hoping I'm wrong, but if I'm correct, the vaccine itself makes people immunocompromised. And if a lot of nurses are getting vaccinated, then you're going to have a sudden spike up in nurses getting infected with COVID. And that's what I'm predicting. As you know, I'm predicting that a lot of nurses will die uh, even before Christmas. And maybe this is going to clinch it. Nurses being vaccinated tomorrow and this week. Some of them may get infected like this week after the vaccine. I don't know. I'm hoping not, but let's see. We have to see the data, right? Because hospitals are keeping record of nurse infections from COVID. So if there's a sudden spike up after the vaccination, they know the vaccine is responsible for it, right? And I would encourage all the chief nursing officers, all the chief medical officers, all the CEOs of hospitals to specifically examine this among the nurses who got vaccinated. What's the rate of infection after the vaccination? I'm hoping that I'm wrong, but as you know, I'm predicting that vaccinations may make nurses more vulnerable to COVID infection. So I'm predicting a sharp increase in infections of COVID among nurses like this week and next week. And some people can die suddenly. This COVID can be unpredictable. I'm predicting that out of 25 of us who graduated from Georgetown University with Master in Clinical Nurse Leadership in August 24, 2020. If all 25 of us are working at hospital, I'm predicting that 5 will die before Christmas. Yes, I know we have 12 days left. A lot can happen in 12 days. People can die like the moment they find out they got infected, they can die that day. So yeah, so I'm going to cheer for them. CNL 2020, yay! You may die from COVID before Christmas 2020, but at least you could say you graduated from Georgetown, yay! So yeah, I hope none of you die. I love you guys, but this is COVID. It's a global pandemic, and that's what COVID does, right? So we have to be realistic about it. You know how when people experience grief, they go through denial. And I feel like we as a nation is entering the stage, or we are in a state of denial still. We are in a state of denial, right? We're denying. We're in a state of denial that this is, like people think that we're supposed to live a normal life right now. People are in a state of denial that this is the new normal, permanent condition. They want to convince themselves like somehow we're going to go back to normal, you know? And this state of denial, in my opinion, is why people are believing in the vaccination because they don't believe that this COVID-19 is real, right? This world that we are in now in America, this is not really real. They're in denial. Although they're living it, although they're wearing a mask when they go shopping, they're in denial like this is temporary, you know? And that's why when vaccine came out, they're like, oh, I could get a vaccine shot and I could just like not wear a mask and do whatever I did before, like in 2019. That's what like a lot of people are thinking. They're in a state of denial. And the biggest problem that I see is both Democrats and Republicans and the media, and I don't believe the liberal media, both Republicans and Democrats, they're living, like they're kind of like encouraging this denial. Like it's not like you get the vaccine and everything goes back to normal, but they're making it seem like, oh, get the vaccine so you could go to work, get the vaccine so you could go to school. Like vaccine is a cure-all. Like vaccine is going to make you like invincible to COVID. And I think that's being dishonest. Um, and that's the problem, right? Because a lot of people are in a state of denial that this is our permanent condition. A lot of people are thinking, well, this is temporary. They're like, I'll take the vaccine and then I'll do whatever I did before. And it's a serious problem. So a lot of people probably will do that. They'll get the vaccine and then they'll do what they did before. And that could be, raising spike in COVID-19 cases, especially because I don't believe the vaccines work. Because there are thousands of strains of COVID that have not been identified yet. So um, even if, and that's a big if, COVID vaccine works against like one or two strains, there are thousands of strains against which it won't work. So you still get infected. You see what I'm saying? So I think like having the vaccine as a Linus blanket or like some kind of a panacea, it's a serious problem. But that's how Democrats and Republicans are selling it. And the liberal media is selling it like that. Like you take the vaccine, everything's it's going to be okay, right? And this is what I call a state of denial. There is a national state of denial right now in America because they're going through stages of grief. They're stuck at denial, right? They're denying that this is happening. They're denying that this is permanent. They're denying like how horrible this is. They want to open schools because they're in a state of denial. Everybody who wants to open schools, whether they're Fairfax County liberal, raging progressive Democrats or Republicans, I would say they're in a state of denial. They're like, we can beat this COVID. How are you going to beat the COVID, which is a virus you can't even see, and its chief purpose is to infect and kill? How are you going to beat it? You know what I mean? The whole language about we're going to win the war against COVID uh, is an example of denial. They don't understand that this is a global pandemic. This is not a war that you can win, like in the traditional sense of the term. You know, so even the languaging of COVID and our experience with COVID shows that our nation, United States of America, is stuck in the stage of denial in the grief process, and it's a serious problem because until we have acceptance, we're not going to come to the resolution of the grief process. And that's the problem that I see. As you can see from this show, I've accepted COVID-19 for what it is. It's a global pandemic. It's a virus that infects and kills. And I've given you advice on how to survive accepting COVID-19 as what it really is, right? So you accept COVID for what it is, and then you deal with it based on the reality of its identity, right? And that's what I've been encouraging you, right? This is COVID. How do we survive this? Given the fact that COVID is like this. And so I have kind of taken the strategy of survivalist attitude, right? How do you survive? How do your children survive? I haven't taken the strategy of warfare. How do you fight COVID? I mean, no, anybody knows in any kind of conflict situation, the best thing to do is run, right? Like if there's a gunman who comes into your workplace, you don't try to combat him with a broomstick, you run and hide. That's like strategy number one is run and hide, call 911 and stay hidden. Um, so, like with COVID-19, the best way for you to survive is like run and hide, right? So, that is the best strategy for survival. So the question is, what strategy do you want to use? Strategy for survival? Uh, Apparently, United States government is not using strategy for survival. Right? Democratic Party is not using strategy for survival. Because a lot of these Democratic governors like Cuomo, we can beat this. It's a very confrontational language with a virus that we don't even understand. Um, we still have so much to learn about coronavirus. And so that's why I feel like this is not helpful to the survival of people in America. Opening schools is not helpful. What does that accomplish? Well, what are you trying to prove? What are you trying to prove by opening schools in a global pandemic? Well, that you could beat COVID, an invisible deadly virus? I mean, how is that rational? You see what I'm saying? So, what I present in this show, COVID-19 Update by Heerak, is a rational approach, critical thinking approach to understanding COVID and surviving COVID. I don't believe the liberal media that try to sell you voodoo science. Oh, this COVID vaccine is going to work. Oh, how exciting! We're shipping out COVID vaccine. Blah blah. It's like sensationalism. It's not rational. It's kind of like Stone Age kind of logic. That CNN is using. Oh, look at all the trucks filling up with COVID vaccine. Oh, how exciting! And there's no evidence that it works. There's no conclusive evidence that it works. So all these sensationalists like hyping, that's not journalism, that's not news. So CNN is proving itself to be a big joke. Um, you know, um, it's like a propaganda machine for the government. We have vaccine. Look at the trucks. CNN is like nothing but a big propaganda machine for the vaccine program of the government. It's not critical news. Yes, I have no respect for CNN. I mean, do some real serious journalism for God's sake. I don't believe the liberal media. Um, yeah, but anyway, yeah, as you know, I created this show to save you and your children from COVID-19. I want you to understand COVID-19. I want you to accept COVID-19 for what it is. I want you to understand who you are and where you are in reference to COVID-19. That's the best way to survive. Not in denial stage, trying to capture the glory days of the past. Um, try to like fake COVID, like it's football, match. No. The best way to survive COVID is understand what is COVID? What does it do? What are your chances of survival if you confront COVID? You know, you gotta take a rationalist approach if you want to survive. Now, not everybody wants to survive. Some people have a death wish. They want to confront the COVID, even though their chance of winning is like zero. You know what I'm saying? That's the problem, right? As you know, I worked for 3 months to lobbying to close out Virginia's 8th District Public Schools, Arlington County Public Schools, Falls Church City Public Schools, Fairfax County Public Schools, and Alexandria City Public Schools, 4 public school districts. And I succeeded in closing them down. So none of them opened classes in August, right, or in September. They all went virtual. And that's the best gift I gave to you. That's like my early Christmas gift. All the parents and all the children in Virginia's 8th District. But Tom Barrow was nowhere, right? He didn't care about that. I did. And that's what makes me a better candidate for U.S. Congress in Virginia's 8th District for election year 2022 than Don Barrow. Because I have the foresight to look ahead. Right? Virginia cases are lower because we didn't open these schools. Right? Look at Pennsylvania numbers. It's crazy. Because they opened their schools. You see the difference? Because Pennsylvania, they have these liberal Democrat governor opening all these schools. And I'm like, don't open them. They're like, oh, we could beat this thing, blah, 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 blah. You can't beat this COVID. You gotta take the survival approach. But Pennsylvania Democratic Governor Tom Wolf doesn't want to survive, it seems. He wants to lead the whole state into death, COVID-19 death. And that's the tragedy, right? Some people are like that. Some groups are like that. They wanna they want confrontation that will end in their extinction. And we've seen that in history. History shows examples of extinction due to conflict escalation. So yeah, so it's kind of like it's a numbers game. There are far more viruses than you. You know what I mean? There's no way you can win because there's so many viruses. And so you know what I'm saying? I mean, if you're in a room with COVID viruses, there are probably a million COVID viruses in that room. How are you going to win? How are you going to win against all those viruses? It's a numbers game. You should watch the movie 300. It shows it doesn't matter how superior you are, how smart you are. At the end of the day, war is about numbers. And there's just so many more viruses than you. Doesn't matter how smart you are, you can't beat it. So that's why I'm encouraging a survival mode. But if you choose to take the confrontational mode, I don't think it will end well. That's why so many people are dying in America. They're taking this confrontational approach. They're like, let's open up schools. Let's see who wins. Of course, you're going to lose. COVID-19 has far more numbers than you. You open up schools with these millions of viruses are in every room. Of course, you're gonna succumb to the virus. You're gonna lose, and that's what's happening right now. Anyway, I'll bring you more important facts and data that you need to survive COVID-19. I don't believe the liberal media. Liberal media is not rational. Liberal media does not give you the information you need to survive COVID-19. And so, yeah, so yeah, so I'll bring you more facts and data tomorrow. So tune in. Tell all your friends to tune in because do you want to survive COVID or not survive COVID? That's what it boils down to. And this show is about survival. Your survival and your children's survival. Do you want to see your children die from COVID, these millions of invisible viruses? I mean, do you really want your children to risk COVID-19 death? Do you see what I'm saying? Your children's life is so important, and I'm sure you love your children. Why would you want to risk their COVID death? You see what I'm saying? Because that's definitely coming if you want to confront the virus. And it's not just one virus, really. It's millions of viruses, right? Yeah, I mean, they're everywhere. Like, you look at this, they're everywhere. So how are you going to win? You're not going to win. So that's why, I'm saying, take the rational approach, take the scientific approach, understand who you are, understand who COVID-19 is or what COVID-19 is before you have acceptance. You may be in a grieving stage. You need to understand and accept the situation, right? To have healthy grieving process that leads to healthy outcomes. You see what I'm saying? So yeah. So I look forward to seeing you tomorrow. I hope that you'll be well and that your family will be well too. Bye.